Now, we turn to a topic that touches each of us, a topic that demonstrates as well as any other how big money can be used to generate spin and controversy that divides the American people. Controversy explicitly planned to create cover for industry profiteering. Dr. Ted Brown, professor of history and public health sciences and medical humanities at the University of Rochester, and Sue Ladwig, research and QI coordinator for the Palliative Care Program at the University of Rochester Medical Center, are internationally known for their expertise in healthcare delivery. And they are here today to share their studied assessment of how the insurance and pharmaceutical industries keep profits up at our expense. They'll make their case by unveiling pieces of their new book, The Quest for Health Reform, A Satirical History. Dr. Ted Brown and Sue Ladwig. Screen down, please.
Screen.
See what you meant about blinding.
So we can be able to see from the back?
Yeah, you'll look over to the right.
Look to the right.
There you go. See it?
Okay. There's the title page. Oh, that is the cover of our book. And Sue has a copy, which she is waving about at you. It's a book you should all get and read and learn from. And there are flyers on the back table with information about how you can order it. It's cheap, $26.50, and you can order it directly from the publisher, the American Public Health Association, or you can get it on Amazon.com. So let's give you just some sense of what this book is about. It's a combination of brilliant political cartoons. There are about 200 of them altogether. 10 of the cartoonists are winners of the Pulitzer Prize for editorial cartooning, some of them multiple times. And those cartoons are woven in and out of a text that we've written that gives you both a historical and an analytical perspective on what health reform has been like over the last century or so, and what some of the struggles have been. Most of the book focuses on the recent period, from about 2009 to 2008 to the present. But there is a long run-up to that that goes back to the turn of the 20th century, and you can see that represented in the cartoon in the upper, I guess your left, I'm not sure, the column, the cartoon with the two people with umbrellas goes back to 1910, and then if you can pick out what's on the cartoon to the next of it, we see 3 presidents going back to Harry Truman in the 1940s, right up to the Supreme Court decision represented by the cartoon in the bottom corner of the past summer. So this is the broad scope of the book, and what we try to do is look at this period and show just what the struggles are, how political rhetoric has been used, how people have been manipulated, how scare words have been introduced, all to avoid real discussion and debate and true political democracy in this very important area. It's a sad, awful story, and the only way you can get through it and feel armed for the next phase of the battle is to laugh at it a little bit, which is why we use cartoons.
So here's one of the first cartoons we wanted to show you today. Here we have Uncle Sam to the left looking at what has been delivered. You can see it's a technical conglomeration of individual mandates, employer mandates, market regulations, insurance regulations, and not least profits. That's a metaphor for the Affordable Care Act. And progressive critics believe the Affordable Care Act is a highly flawed patchwork measure that layers on all of these technical fixes. And it is far inferior to a single-payer system that's proposed by many health activists, including Ted and me, and many of you. And it is also a system that has proven effective in many other modern democracies.
Could you advance the slide? Mm-hmm. Oh, there we are. Okay. So why are we here now? And we have several people and institutions that we need to blame. Part of the blame has to fall squarely on President Obama himself, because the real President Obama, as opposed to the President Obama of soaring rhetoric, of which we'll hear more tomorrow, caves, as we all know it, at some crucial moment when the politics gets tough and when someone with truly progressive principles should be there, he disappears. And so he caves when he needs to stand firm, and this cartoon captures his partial channeling of Teddy Roosevelt. Teddy Roosevelt was one of the first presidents who supported the call for universal health care reform in the United States. He did that soon after he stepped down from his term as president on the Republican ticket and ran on the new Progressive Party ticket with a strong campaign for universal health reform. So here in this cartoon, a brilliant cartoon by Matt Worker, who was the most recent Pulitzer Prize-winning cartoonist in our book. He won it this past spring, 2012. Shows Obama channeling Teddy Roosevelt, that part of it, but forgetting that other crucial part of Teddy Roosevelt's approach. He's hesitating to carry that big stick, or to have a firm backbone, or to stand up when he needs to stand up.
So another cartoon in our book identifies some of the political posturing, or worse. And here I want to lay blame on the Republican Party. We're blessed with this very partisan political process. But instead of Medicare, here's the Republican vision of we don't care. Health security for all ages. And we can see in this parody, this card, you get squat, you're entitled to nothing, entitled to zip, no hospital care, no medical care, signed, I am broke. Is this reality?
But as you can see in this cartoon, the problem doesn't rest only on the Republicans. Many of the Democrats, in my view, and I think in many of yours, are just as bad. It comes back, as I'm sure you know, to the perverse influence of big money, which is an equal opportunity corrupter of the political process. And as you can see in this cartoon, it buys off Democrats as well as Republicans, so that so-called health reform is embodied in the Affordable Care Act, as in so many other things, is corrupt and gives over much of what should be protections of the public to large industrial, pharmaceutical, insurance corporations. In other words, one way to put it, as you can see here in this bipartisan relationship, is that we've got the best Congress that money can buy.
And not only do we have the best Congress that money can buy, but we have the best private insurance industry that money can buy. Here we see Healthy Profits Incorporated, with awareness growing that the fear of a government takeover of healthcare was in many ways a deliberate scare tactic, as Matt Worker shows us in this cartoon. And I have to tell you, Matt Worker, as Ted mentioned, is a Pulitzer Prize-winning cartoonist, and he's absolutely brilliant. We originally wanted to include 29 of Matt Worker's cartoons in our book, and we were told by the cartoonist group that you guys should try to use some other people too. But Matt Worker delivers his cartoons very poignantly with brilliance. So here we see that private health insurance industry saying, are you nuts? Government health care would create a health bureaucracy. They stand behind healthy profits, claim denials, relentless advertising, indecipherable paperwork, pre-existing conditions, rescissions, red tape, runarounds, and many, many more. Private Healthy Profits, Inc.
For the Affordable Care Act, as you study the political dynamics that led up to it, a lot of the attention has to focus on Senator Max Baucus, who is represented there in the front, a very conservative Democrat from Montana, who is chair of the crucial Senate Finance Committee, through which all prospective legislation from the Senate side had to pass. The plan he came up with, which is really the essence of the Affordable Care Act, of Obamacare, was very friendly, overly friendly, to the health care industry, pharma, insurance, and so on. And he didn't even consider a single-payer Medicare for all alternative. And as you can see in this cartoon, the lobbyists in the background are saying, we're not getting a gift, we're getting good value for our money. We know what we paid for. But the single-payer alternative, which would have been much more efficient, much more effective for the American people, was shut out of discussion. And when those who wanted to argue for it, make the case for it, tried to get airtime in the Senate Finance Committee hearings, they were not only shut up, they were arrested. 8 of them became the Baucus 8, spent some jail time to try to stand up for the principle of single payer as a real alternative. But with the brutal power of the Senate, they were ruled out.
A single-payer healthcare system was not the only thing that was ruled out. In this cartoon, with pharmaceutical companies gleefully leading the way, we can remember that the Affordable Care Act does not allow importing of cheaper drugs from Canada and Europe, or even the leverage of federal bargaining power. Patient advocates wanted to keep that federal bargaining power as leverage to help keep drug costs lower, but that's something else that we don't have. Oh, that's mine too. And here's something else. One of the issues that was most shouted about in 2009 in the run-up to the discussion of the Affordable Care Act was the so-called death panels. And this is really a gross distortion of the proposal to reimburse providers for optional end-of-life counseling. This term was first used in August 2009 during those hot town hall meetings. And it was first used by Sarah Palin, the former Republican governor of Alaska, and you remember as John McCain's running mate, when she charged that this proposed legislation would create a death panel of bureaucrats who would decide whether Americans like her elderly parents or her son with Down syndrome, were worthy of medical care or not. And so due to public concern or public shouting down, the provision to pay physicians for providing voluntary end-of-life counseling was removed from the Senate version of the bill and was not included in the law that was enacted. Many physicians believe that it's a very important piece of quality medical care.
I'm not going to let the Democrats or President Obama off the hook. They belong on it. And so whatever you may think of the Republican Party and its positions on affordable care, let's realize that President Obama caved in at a critical moment and came out looking, as this cartoonist captures beautifully, Prime Minister of England, Neville Chamberlain, in 1938. That's Neville Chamberlain's color, that's Neville Chamberlain's words, slightly modified. It is the great appeasement of Hitler when, in the Munich Agreement of 1938, England agreed to the ceding of a considerable portion of Czechoslovakia to buy peace in our time. But of course, we all know that within a year, Hitler moved on Poland, and Britain was forced to reverse itself and declare war on Germany. There is President Obama saying, health care in our time by GOP appeasement. And we've got to acknowledge this, and we've got to stand up. So this is also an example of the way cartoonists use historical moments or historical film or other artworks and make a pun on it visually in order to get their message across. This is a visual pun, but the important political message in this visual pun is let's stand firm when standing firm is required. The outcome of the political process, when Democrats and President Obama didn't stand firm, is that political cowardice, that appeasement, came through by giving major benefits to the healthcare industry and not just to concede political points to the Republicans. Instead of standing up to the healthcare industry and fighting hard for single payer, instead, large pieces of new business were given to the various for-profit corporations, and they got the oversight and the essential involvement in the Affordable Care Act. Industry support, in other words, was bought consciously by the Obama administration in turn for supporting and not opposing strongly the Affordable Care Act. But the Affordable Care Act that was gotten by shoveling large amounts of money to the insurance industry, guaranteeing new business on the terms that they liked to Big Pharma, meant that what we got was far, far inferior to what we should have gotten. And as you can see in this cartoon, the corporate executive for the healthcare industry is saying, "Thank you so much for the 30 million new customers. There is no right to health care guaranteed in the Affordable Care Act. There is a right to new customers by the insurance industry."
And not only is there a right to new customers for the insurance industry, but the other piece of the Affordable Care Act that the piece that was not upheld was Medicaid expansion. And we've already heard from the governors of many of the red states, the southern states, that they are not going to allow Medicaid expansion in their states. The Supreme Court ruled that to force a state to expand their Medicaid rolls was coercive, and they struck that portion of the bill down. What this means is that folks under 133% of the poverty limit are not necessarily guaranteed access to health care. Here we have a brilliant cartoon by Pulitzer Prize winner cartoonist Nick Anderson, who demonstrates to us just what the plan is for those red states in which the governors don't want to expand Medicaid rolls. We have a plan. We're going to just dump them on the ERs. That's all I can say about that.
This is the last cartoon in our presentation today, but if you like them, run out, get the book, order it online. There are 190 more in the book. This one is by Matt Worker again. It is an incredibly smart, clever visual pun again. You see Obama in the gears of the healthcare industrial machine, Nancy Pelosi at one side, Harry Reid on the other, and someone is saying, "Why didn't we think of single payer when there was still time?" This, of course, is a visual take on that incredible scene in Modern Times in which Charlie Chaplin's tramp character is caught literally in the gears of the machinery. So here is Obama being caught in the gears of the healthcare industry rather than opting to step outside it and start again. Can Obama escape from those gears? Well, not as of yet. Can anything be done to try to start again and put things on a single-payer Medicare for all basis? There's only one way to do that, and that has to come from you. And from grassroots insistence, that will change the system. Nothing else will. Thank you.